Hello, I am Dhwani, second year BPT student. Today I am discussing about joint mobilization and manipulation in exercise therapy. So, joint mobilization is a manual therapy technique used to improve joint movement, reduce pain and restore function. It involves gently moving a joint within its normal range in a controlled way. Mobilization can be given in the synovial joints like knee, shoulder and hip. Glenohumeral joint. Glenohumeral joint is also known as shoulder joint. It is a ball and socket variety of synovial joint. Arthrokinematics. Convex humeral head glides on a concave glenoid fossa of scapula. Concave-convex rule. When a convex surface moves on a concave surface, roll and glide happens in the opposite direction. When a concave surface moves on convex surface, roll and glide happens in the same direction. Indications and goals. Primary goals: pain relief in grade 1 and 2, improved range of motion in grade 3 and 4, restoration of normal joint play. Indications: adhesive capsulitis, post-surgical stiffness, reduced range of motion. So, there are 5 grades of Maitland mobilization classification. Grade 1, small amplitude rhythmic oscillating mobilization in early range of movement. Grade 2, large amplitude rhythmic oscillating mobilization in mid range of movement. Grade 3, large amplitude rhythmic oscillating mobilization to the point of limitation in range of movement. Grade 4, small amplitude rhythmic oscillating mobilization at end range of movement. Grade 5, small amplitude quick thrust at the end range of movement. Types of glides. There are mainly 3 types of shoulder glides: anterior glide, posterior glide and inferior glide. These glides follow the concave-convex rule, where the convex humeral head glides in the opposite direction of the bone's movement to restore its normal mechanics. Anterior glide. Purpose: improves external rotation, improve extension, can help in anterior capsular stiffness. Patient position usually supine or prone. Shoulder in loose pec position, about 20 to 25 degree abduction. Therapist action: it stabilizes the scapula. Apply force to humeral head in the anterior direction. Posterior glide. Purpose: it improves internal rotation, improves flexion, commonly used in posterior capsular tightness or frozen shoulder. Patient position usually supine. Therapist action: stabilize the scapula, push the humeral head in posterior direction. Inferior glide. Purpose: improve abduction, helpful in subacromial impingement and capsular tightness. Patient position usually supine. Therapist position: stabilizes the scapula, glide humeral head inferiorly down. Mobilization with movement. Sustained glide applied by the therapist while the patient performs an active movement. Goal: immediate pain-free movement in function. Example: posterior glide applied while the patient actively reaches behind the back. Precautions and contraindications. Fracture, joint dislocation, severe joint instability, active infection, malignancy, severe osteoporosis. Precautions: painful joints, joint hypermobility, joint diffusion, acute inflammation. Thank you. I will demonstrate the glides of glenohumeral joint. So first we are starting with the inferior glide. So for that, patient position is supine lying, shoulder outside the plinth. Then we have to give the distraction. Then we will give the glide like this. So now we will give another posterior glide. So for that we will give distraction and then like this. So the next glide is the anterior glide. For that the patient position is prone lying. First we will give distraction and then give the glide